All right, so now we're going to talk about the three types of wound healing, which describe how the edges of a wound come together. So the first one is going to be called first intention, also known as primary intention. And that's when the wound edges are brought together, kind of like with stitches or staples. Healing is usually faster and there's usually minimal scarring. Second intention refers to like the wound being left open and it heals from the bottom up. So this happens with large wounds, pressure injuries, or any kind of wound with significant tissue loss, and it takes longer and it leaves more scarring. The next one is going to be third intention, also known as delayed primary closure. And this is a combination. So the wound is left open initially to allow for cleaning or infection control, and then it's closed together. And it's usually used for contaminated or high-risk wounds. So an example of this is going to be like a dog bite or human bite. Say it's in the hand. So these wounds are considered high risk for microbial infection. So usually it's going to be initially cleansed and then left open, and then the wound is going to become closed later once there's no, like, once it's clear that there's no infection. So there are two major mechanisms for your body that your body uses to repair skin. So the first mechanism is regeneration. So the body replaces damaged tissues with the same type of tissue. This happens mostly in partial thickness wounds. The next one would be scar formation. So the body replaces tissues with scar tissue made of collagen. This is common in full thickness wounds. Now we're going to compare the wound depths. So and one part of that is the partial thickness wounds. So a partial thickness wound affects only the top layer of skin, also known as the epidermis and part of the dermis. So some key points about it is that these heal quickly, often by regeneration. There's minimal scarring. Some examples would be abrasions, stage 2 pressure injuries, and shallow burns. I do have a picture of a stage 2 pressure injury right there. So you can see that only the top layer of skin is affected. The next one would be a full thickness wound. So a full thickness wound goes through the epidermis and the dermis and may extend into the subcutaneous tissue, muscles, or even bones. So those heal by scar formation, not regeneration. They do take longer to close. They may require sutures, grafts, or advanced wound cares. And examples would be surgical incisions, deep ulcers, and severe burns. So those are going to be the type of wounds that a wound vac is used for. And basically what a wound vac is it's kind of like negative pressure wound therapy, and it is common used for full thickness wounds. And it's most appropriate for wounds that extend through the dermis and often involve subcutaneous tissues, muscles, fascia, and exposed bones or tendons. And these are full thickness wounds, and they benefit from wound therapy because the negative pressure promotes granulation tissue formation. It removes exudate, it reduces any edema, and it helps the wound heal kind of like from the bottom up. Um, and it also helps approximate the wound edges, and it helps prevent any infection. Okay, so today we covered the phases of wound healing, all 3 types of healing, how the body repairs itself, the differences between partial and full thickness wounds. Hopefully the visuals help you understand what's happening as your skin heals. If anything changes in your wound, or if you notice signs of infection like fever, increased redness, foul smelling drainage, or like yellow discharge, please let me know right away and we can come take a look at it and redress it for you. I'm here to support you. Let me know if there's anything I can do for you.